So I'm recording on my phone right now because I think I'm having some technical difficulties with Kaltura. I have a meeting with Apple support tomorrow, so hopefully this works. So for the first question, how would you describe your experience with health insurance in terms of accessing care? So far, unfortunately, my experience with health insurance has been a poor one. The application forms are difficult to complete even for me, so I can't imagine patients like, for example, with learning disabilities and the struggle they might face while trying to fill out the forms to receive like vital health insurance services. I would say also the literacy portion of the Medi-Cal application is a huge barrier for some individuals. And upon receiving the insurance, there are many barriers as to what insurance will cover or approve. So, for example, I've seen clients run into issues of needing a medication, but as it's not on the formulary that Medi-Cal covers, they get denied to receive life-saving medications. And they either are forced to pay out of pocket or forego the medication altogether. The second question, what, if any, were some of the barriers you encountered? So like I stated earlier, literacy issues being huge, and I've seen it just really difficult to break it down sometimes for people, and there's not always people available to help fill out those applications. And also another barrier is, what actual services will the health insurance cover? So running into issues where they have the health insurance, but then when they need life-saving, interventions, they aren't covered. So having to come out of pocket for those medications and not being able to afford it. Third question, in your opinion, can these barriers be attributed to societal values? So in my own biased opinion, I believe that healthcare should really be a universal right and not just a privilege, but even after implementing Obamacare, there's still so many issues to accessing like needed healthcare resources. So I believe we are still at the societal value right now presented in slide 8, that there are so-called worthy and unworthy individuals who are receiving health insurance. And I also believe the social construct of public assistance or social insurance is a factor, as the funding for health insurance, especially premium, comes from like affluent individuals who can afford it, and the funding that goes towards individuals needing Medi-Cal is through government assistance, and the insurance applications are extremely heavily regulated for those individuals, making it difficult for many to receive the health insurance and unaffordable for others to purchase it out of pocket. Fourth question, have you heard of any policy issues that would improve access to care and or address the barrier you described? Having additional supportive services for clients in need of support, for example, completing applications, and not just like interpreters to address language barriers, but also interpreters available who can help break down those applications, because it can be very hard to understand some of the like lingo on the applications, and I really think that there needs to be more individuals available to break it down in layman's terms. So there should also be a law implemented for individuals in need of medical interventions or medications to automatically be approved, like regardless of the medication or treatment, and regardless of it being on the formulary, because there's just so many people turned down because it's not on the list that they approved, and it can be a life-saving measure. Fifth question, to the best of your knowledge, who or what entity has the power to make a change to the policy issue you identified? I really believe this is like a macro level intervention, but it really does take individuals wanting to make a change to get the ball rolling. So for systematic change, I think a huge thing is just getting involved and like being politically conscious. And I think first steps on an individual level is reaching out to like grassroots organizations and coming together. In your opinion, is the issue visible to the broader public? Why does visibility awareness of the issue matter? I think this is definitely a public issue by nature and should be portrayed in the media. And that's to address the issue in order to get like more people, aware and willing to collaborate and get involved in the change movement, because really the first steps is becoming politically conscious. And the last question, after learning about Angela Donnelly's health policy practice at the county level, how would you approach policy advocacy? So for me, I did learn a few things. I myself, I'm very busy, and thinking about showing up in person to an advocacy event sounds amazing. Really, it does. But, I'm just, for me personally, very overwhelmed with 2 jobs and grad school and trying to do guardianship with my nephew. So I think a more effective measure for me would be to really advocate via emailing, because I learned, listening to her, that there are people that actually do check those emails, and I think that's amazing, because I always thought that it would be a futile thing just to send an email and it would just be glazed over and not even, opened. So I do really think that's cool. And, now my next question for myself is, how do I get these individuals' emails so I can start spamming them?